We are taught to educate the patient and then make clinical recommendations. If that fails, we might say things like, well, all I can do is give them my advice. And if they're not ready, they're not ready. Sound familiar? Unfortunately, the current approach only leads to hearing aid purchases about 56% of the time. People who find a hearing clinic, book an appointment, bring a family member, and show up on time are motivated to make a change. This is precisely why motivational interviewing really is the missing tool in our counseling kit. Motivational interviewing is proven to be effective in facilitating health-related behavior changes. MI begins with recognizing the stages of change, also known as the trans-theoretical model of change. Patients can stay in this contemplative stage for up to a decade, so shortening the amount of time spent here is the best use of MI in our practice. How we respond to any ambivalent statements they make is very important because we really want to keep them on the right path. In general, when working with a patient in any stage, do not be afraid if you hear change talk and sustained talk mixed together. Stating both sides of how we feel is part of the process when we're working through a big decision. The acronym ORS is used to refer to open-ended questions, affirmations, reflections, and summaries, which are all tools that MI relies on. It can be tricky knowing the right time to use each of these and in what way to use them. However, with a little practice, we can skillfully guide a patient through their ambivalence. I want you to figure out what stage of change your patient is in based off the language they are using and the reasons they are giving. Practice identifying these ambivalent statements. Be curious. What are their pros and their cons? Now I want you to ask open-ended questions about any change talk you hear and control the narrative. What kinds of things are they talking about? Create as much unique change talk as possible.